So treatment, and this is just a very sort of cursory taste of the treatment options. We have, amazingly, in the medications, we have about 30 FDA-approved antidepressants. We have multiple classes of antidepressants that are FDA-approved. The most famous ones and most common ones are the SSRIs, the serotonin reuptake inhibitors, but there are other variants of those. There are newer antidepressants, and it gets a little confusing. What is an antidepressant? Because nowadays you have drugs that were initially used in schizophrenia, so-called antipsychotics, that are also FDA approved for depression. So examples would be aripiprazole, quetiapine. These are all drugs initially studied for schizophrenia, but now are approved in bipolar and in major depressive disorder. So these are so-called augmentation drugs. So it's a little bit of a misnomer. The terminology is confusing to call it an antipsychotic, and sometimes you prescribe, or I prescribe a drug like aripiprazole, and then a patient will Google it and say that it's antipsychotic, and then they'll say, doc, I'm not psychotic. I don't have schizophrenia. Why did you prescribe this medication? And it's because it's really a misnomer. I mean, these drugs are used across the spectrum of disorders. So we need better terminology, really, than what we have. And antidepressants, of course, are used in anxiety and in other indications, including OCD, obsessive compulsive disorder, and bulimia, and so on. Psychological therapies, there are a number of great evidence-based therapies, which it may involve in-office therapy, but also you could do this via telemedicine in some of these platforms with good evidence for remote benefit of these psychological therapies. And what's listed here are 4 of the better known ones, but there are other ones, including group psychotherapy, mindfulness-based approaches, interpersonal problem-solving therapy, and so on. So there's a very rich literature and evidence base for these psychological and behavioral therapies. And then the other category is generally what we call broadly neuromodulation. And electroconvulsive therapy is the oldest and best known of these approaches, which is the administration of electroshock therapy. It's generally used in the US for the most severe treatment-resistant patients, inpatients who may be suicidal, as a means to rapidly get a patient better. And this is administered Monday, Wednesday, Friday for anywhere from 9 to 12 sessions, generally. Transcranial magnetic stimulation is an FDA-approved device, FDA-approved since 2008. It's the application of a magnetic coil to the left side of the head. It doesn't involve anesthesia. It is completely at the surface of the head. And there's evidence for its use in major depression, in smoking cessation, depression with anxiety, OCD, and some other indications. Vagus nerve stimulation is a neurosurgical implanted device underneath the clavicle and then extending through the vagus nerve of the neck. And that is FDA approved since 2005 and has been undergoing trials. It's not widely used right now because of the lack of Medicare coverage, but we'll see if the controlled trials are positive, which would change the reimbursement landscape.